If you're new to the subject of mental health and want up-to-date, accurate and reliable information, where do you go? In my experience, what can start out as a simple search for symptoms, prevalence or key dates can easily lead you down a rabbit hole of misinformation, purpose washing and out-of-date statistics. So, to make things easier for you, here are my top 5 most trusted mental health resources. Ready? Let's get into it. Since 1949, the Mental Health Foundation has been the UK's leading charity for everyone's mental health. They test and evaluate the best approaches for improving mental health in communities, as well as publish studies and reports on the risk factors for poor mental health and how to tackle them. Check out the Explore Mental Health, which contains content and resources designed to give you more information about mental health, how to look after it, and how to prevent mental ill health from developing in the first place. The Mental Elf is a subsidiary website of the National Elf Service. They have a team of mental health experts who publish blogs every weekday with short and snappy summaries of the evidence-based publications relevant to mental health practice in the UK and further afield. To do this, they sift through over 500 journals, databases and websites every week to find key guidance, systematic reviews and high quality research that will help to facilitate better conversations between clinicians, patients, carers and healthcare professionals. A couple of really insightful articles that I've found via this website include parental suicide and the increased risk of suicidal behaviour in bereaved offspring, and a new study that looked at the link between those experiencing schizophrenia, cannabis use and the risk of relapse. The King's Fund was formed in 1897 as an initiative by the then Prince of Wales to allow for the collection and distribution of funds in support of the hospitals of London. 125 years later, they continue to work as an independent, charitable organisation with the vision that the best healthcare be made available to all. Their work spans the length and breadth of healthcare policy and practice, with the main objectives being to drive improvements in health and well-being in places and communities, improve health and care for those living with the worst health outcomes, and support people and leaders working in healthcare. Examples of their work include, but are not limited to, commission reports, evidence and consultation, blogs, and data visualization. The National Institute for Health and Care Excellence provide advice, guidance, and evidence-based recommendations developed by a committee to improve health and social care. Much like the King's Fund, their work covers a lot more than mental health, but for the purpose of this conversation, if you click on the Lifestyle and Wellbeing tab, you'll find advice and guidance on mental health, behaviour change, addiction, and much more. Alternatively, you could use the search bar at the top of any page to find the latest guidance and recommendation on the healthcare subject of your choosing. The Centre for Mental Health is an independent, non-for-profit think tank. They are dedicated to eradicating mental health inequalities and fighting injustice by changing policy and practice. They do this by combining lived experience, economic analysis, needs assessment and peer research to drive change and create the conditions for better mental health for all. In my opinion, these guys are leading the conversation when it comes to addressing inequalities in mental health. For example, on their most recent podcast, they interviewed Steve Gilbert, OBE, who was the vice chair on the Independent Review Board, who oversaw a draft bill that proposed some of the biggest reforms to the Mental Health Act in a generation. He also spoke about the disparities in care for black minority ethnic groups, the years lost in institutions as a result, and the impact of racism on mental health. There's a link for that podcast in the description. Do you currently use any of the websites that we've just spoken about, and which mental health resources would you recommend for up-to-date, accurate and reliable information? Let me know your thoughts in the comments section, and if the subject of inequality and mental health is of interest to you, stay tuned and subscribe, as over the next month in the lead up to World Mental Health Day 2022, we'll be releasing a series that looks specifically at different types of inequality and what that means in terms of the health outcomes for the individual. Speak soon.